Welcome back to Out of Network. I'm Dr. Ryon Parker here with Dr. Rishi Seth. Today, we're talking about a topic that we see every single week in our clinics, the wellness world. From IV drips, NAD injections, supplements and spas, anti-aging, biohacking, adrenal fatigue, you name it, someone is going to sell it. And a lot of patients walk in confused, overwhelmed, or frustrated because they're getting 10 different messages from 10 different places.
We're not here to bash wellness. There are things in that space that help people, but there's also a whole lot that's unproven, overpriced, or flat out misleading. And when you're scared, tired, or desperate for answers, those things can look super tempting. So today, we're breaking it down in plain language. What's helpful, what's harmless, and what you should probably stay far, far away from. Let's jump in.
So, Dr. Seth, I have a question for you as a medical doctor. Obviously, we like to focus on evidence-based practices, but how do you as a physician treat or manage those patients who have seen our chiropractic colleagues, our naturopathic doctor colleagues, or even med spas that offer wellness services? How do you treat those patients that come in and say, I don't really agree what you're recommending, that this person, this chiropractor down the street is recommending this, that may go against some evidence-based practices? As a doctor, how do you navigate through that?
I mean, this happens so much, right?
Yeah.
Especially now with the age of social media, the information, the YouTube videos of, if you have a camera, you can get our platform, kind of what we're doing, by the way. And you get this opportunity of platform, and then you get to showcase to the world, and then your showcase is based on if you say something viral enough, and that hook catches, and so then you could have unsubstantiated claims, and don't need any medical knowledge behind it. So the reality is, it's very common. I actually have I don't know if I have a nuanced approach, but I have an approach that is, the patient that's sitting in with me has trusted me to that point, right? And I also know that patient has also trusted that naturopath, the chiropractor.
And we don't want to discredit them.
Well, I mean, there's a way to discredit something.
You want to play nice in the sandbox.
It's kill him with kindness, right? It's, you catch more bees with honey. So my point with this is, and I think I learned quite a bit about this during COVID. Whenever, if you shamed a patient or somebody with being an anti-vaxxer, that person officially now hates all vaccine and all medicine.
Right.
And that was the worst thing that could have happened out of COVID, other than the deaths that happened out of COVID, was you discourage an entire generation of people from traditional medicine. Right. And that's where a lot of this secondary medical treatment, spas and natural wellness and all sorts of alternative forms of medicine have come up. And I don't blame them. If you got shamed of what your beliefs were, could have been religious, could have been social, could have been just how you were raised, right? To go back and say, how dare you listen to those guys and not me? I don't think that works. So my approach is, I listen to them. If it's not harmful, I say, I understand. I don't really know much about it. I had a patient once who was like a homeopathic provider, and I didn't really know anything about it. And then at one point, she's like, our stuff is really different. I got to deal with my stuff, my blood pressure. So I'm going to do that too. But I really appreciate you just educating me on that. So that's how I deal with it. I educate it the way I know. I talk about the medicine the way I know. If I know the other option is harmful, I will tell them. Otherwise, you kind of have to say, well, we'll kind of wait and see and go with that.
I think it also comes down to gaining the trust of the patient. And I feel you bring up COVID because it was so politicized at the time. no one knew who to really trust. And I think that bred a lot of discontention within the medical community. And that lack of trust, I think, is what has fueled a lot of people looking at other sources for wellness or healthcare advice, maybe even a lot of it on social media, which is very scary. And so I think it's important to really establish that trust with that patient. And with all this information that we have currently, we learn more in 24 hours than we did in 1 year, 10 years ago.
Yeah.
So there's so much information. And I tell patients all the time, even as a pediatrician, where moms will come in and say to me, well, this mother is doing this with her baby, and that mother down the street is doing this with her child. And I say to her, look, you will be so overwhelmed if you listen to everything that everyone is doing. Find someone you trust, whether it's me, the pediatrician down the street, or whoever, and you need to listen to their advice and one person that you trust, because it can get really confusing and overwhelming at the end of the day. I think for me, I have a story with a lady who was suffering with chronic yeast infections, and she had seen a chiropractor, and she comes in and tells me that she almost brings this recipe card for a treatment that was written. And basically he had recommended a combination of borax, yogurt, garlic. Outside of the borax, it was almost like a recipe for tzatziki sauce, right? I never want to eat at a Greek restaurant again. Bake it at 350 for 2 hours. But I'm looking at this prescription and I'm thinking, well, I don't think you get borax at Walgreens. I think you get it at Lowe's, right? And she is really focused on wanting to do this because everything else maybe failed for her. And I said, I don't know anything about this, but as your doctor, I'm not going to recommend that.
And I think that speaks to two things. One is how crazy that treatment option was, but also like how desperate that patient was.
Yes.
Right? Like she was like at the end thing, I got to figure out a solution. She's not getting all the answers.
Right.
And then she knocks on the guy who gives her a solution.
Right.
How ridiculous that solution is one thing.
Right.
But I mean, it speaks to two things.
And I think it speaks to maybe the personality of the patient. And maybe there are those patients that are really looking for natural options, which I don't blame them. I think that's great. And but why is it so difficult to trust what we know through studies and science and evidence? Right. So it can be very challenging at the end of the day. But no, I said, do not put borax in your vagina. Okay. I also get a lot of, again, this hot trend with NAD and NAD infusions and vitamin IV infusions. And there was a recent JAMA article that was questioning some medical spas on the overall benefits of doing this. You know, I offer IV vitamins at Parker Medical. I probably do more normal saline IV hydration in urgent care situations for dehydration, but there are those patients that have requested it. They have tried it somewhere else and benefited from it. You know, maybe it's a placebo effect, but they have requested it and we offer it. But is it good to offer this if we don't necessarily believe that there's long-term benefits for it?
And I'll say another thing about that. So, you know, the thing that people don't understand about those IV vitamins is they feel initially great. It's because of the isotonic nature of the volume of fluid, right? It actually fills up your blood volume. You feel better because maybe you were on the dehydrated side. That's possibly.
Sure.
The second part is like, let's say you are actually vitamin deficient. Well, you've supplied your vitamin deficiency, but the reality that a generally healthy individual who is seeking medications for optimal care being vitamin deficient is very less likely. They probably eat a regular meal. They probably have decent food. So the likelihood of them having nutritional deficiency is fairly low. Yeah. What they don't understand is when they take their vitamins, they're just going to pee it out. Right. So that there's that. I'll tell you an interesting story. We had a
really quick before. Can I interrupt? what do you tell them if they say, oh no, I was told that this is going to make me live longer, that there's longevity benefits, and that the NAD is helping with addiction recovery, and yeah, I'm able to get off, curb my alcohol addiction.
Yeah.
What do you tell patients?
Yeah. So there's nothing ever been proven to show that. And of course, like there's anecdotal evidence of people who say, oh, I've taken this and that supplement and that's helped them. And I don't want to say discredit that because there's a lot that we don't know. But until I'm going to put my stamp on and say, I agree with it, you just need to see more data.
Right.
And the data isn't there. And here's the funny thing. We have 1,000 IV hydration places in Florida. No randomized studies out of there, right? Isn't that interesting? No, they have data. They could do data on literally thousands of people to prove benefit. They choose not to. There is a reason why, because they don't want to.
They don't want the evidence.
Yeah, because it would show there's no benefit. Yeah, right. Exactly. So that's kind of.
Do you find that there's something unethical about offering a medical service that in all of us we may think there's not long-term benefits for?
Yeah. Well, I'll be honest with you, I don't sell it to my patients. If they ask for it, I'll provide it. More as kind of like a spa-like experience. But I don't sell it in any.
Yeah.
We don't have it on our websites. We don't put it, but it's only if they ask for it and they want it only.
Likewise. I think I offer it, or I talk mostly about it in those patients who are preparing for a surgery or even recovering from a surgery. But again, I think it's the isotonic saline that you just mentioned that is probably the biggest benefit for them. In addition to the hyperbaric, which I know we've talked in previous episodes about hyperbaric medicine. You have a hyperbaric chamber at your clinic, and I do as well. Talk to me a little bit about what you know about the medical benefits as opposed to some of these trends out there that you've been hearing about that is curing autism and helping ADD.
Yeah. I know, well, we know what it's approved for diabetic foot infections or, I can't, it's slipping off the top of my head. I was
decubitus ulcers.
Decubitus ulcer, but for, not air embolism, but baritone.
Oh, yes. Yeah.
For patients who deep sea dive, it's off
I know.
the top of my head. I know we're gonna have to edit that part out. But
the bends.
No, that's air embolism. Yeah, the bends. That's exactly right. Why I don't know why I can't get the medical condition out of it. Anyways, there's guideline recommendations for a couple scenarios from a medical standpoint. But the anti-aging stuff, the autism spectrum disorder, there's no proven benefit.
Right.
Now, there's some studies coming out. There are small studies. The downside with studying for an hyperbaric oxygen machine is that you'd have to have multi-centers with large machines. And, there's not a lot of incentive from companies to push this out. So that's kind of why it's got into the wellness world. But, we have patients who have a post-operative recovery, surgical post-operative, plastic wounds, plastic surgery, abdominoplasty, breast implants, lifts. They want to reduce their risk for scarring and potentially improve their duration of recovery. I've seen some improvement on that, and there's some data behind that.
Sure.
So yeah, it's reasonable to encourage patients with that, but for anti-aging, and it doesn't make sense.
Yeah. And maybe in the future to be determined with additional studies. But I think it's important to tell those patients who are interested in hyperbaric medicine, make sure it's a medical grade hyperbaric chamber, right? And there is a difference between what maybe some of these medical spas offer as opposed to what's in our clinic. And so, encourage those patients to really do their homework before they start paying for expensive wellness services.
That's the other thing. They can be really expensive. And when you look at the chamber pricing, you kind of want to know where are you dreaming up these prices from? Yeah. And so these standalone hyperbaric wellness spas, those are very expensive. Yeah. So before people go down the path of well, I heard it's good for this, do your homework and or talk to your doctor and like really get through the details of it.
Do you offer a lot of supplements or recommend a lot of supplements? And again, talk about anti-aging and longevity. There are those supplements that are sold in these med spas that claim to help you live longer, that are giving you more energy. And do you recommend those to patients?
Yeah, I don't. I don't recommend them. I would say that if they were nutrient deficient, I would find options for them.
Right.
But if like
there was a study that actually showed multivitamins really didn't have any long-term benefits.
There's a study in the Annals of Internal Medicine published, I think it was like 2015. I think it's literally titled "Stop Wasting Your Money." It's literally
Spots of urine.
Yeah,
right?
exactly.
It's the subtitle.
Stop wasting your money. 2015. And I just have always held to that. Now, if something comes out,
Sure,
that's really great. But like we went to these like these training seminars for some of the wellness stuff that I'm trying to get an understanding of this stuff. And you know, they call it nutraceuticals. They don't even want to put the name on it because the name of vitamins has been so poorly identified. So you're just putting lipstick on a pig, you know? I hate that part.
Right.
And you know, the whole crew that they're educating is like all eating that up, and you're just like, guys, like you have to have a secondary way of thinking.
Why is there such a push, do you think, for patients to be seeking this? Is it because everyone else is doing it on social media? Are they grasping for what do you think they're doing this for?
That's a philosophical question,
you know?
All right? But I'll tell you, I have a philosophical point on this.
I do too.
When you're in your 20s, do you ever think about that?
Never.
No. You thought about beer in the weekend. You know what I mean? Like you thought about like, how am I going to have a good time? And 30s come around, maybe that joint hurts just a little bit more. And you're like, oh, it's weird. But like, and then all of a sudden you start to learn like, I can't party like I used to when I was in my 30s.
Sure.
And then 40s come around, and I mean, forget partying. You're just trying to make sure that you get good hours of sleep. There must be something I'm missing.
Yeah.
There must be something I need. And the reality is, people just need to understand that they're aging.
Yeah.
And aging happens.
Yeah.
And like...
And fear. I think people are motivated by fear.
Absolutely. And so we've got like... you all watched like the 60 Minutes with Peter Attia. And like... mind you, I do really like a lot of what he talks about.
I do too.
But there's, what is that other guy? The guy who's like never wants to die? Like what
Ryon.
What kind of nonsense is that? Like, oh, I'm going to spend $1 million and never die?
Well, he claims to have reversed the aging process where his cells are that of a 20-year-old.
He looks like an alien,
right?
Okay,
right.
Let's be honest. Like he hasn't done nothing to reverse his aging cells. But what he's doing is he's pushing that fear that aging is terrible, which it's not, and that aging, because you're aging, you're losing something, which he's not.
Right.
You know what's awesome when you age? Family, friends.
Yeah.
You know, and like, I think as Americans, we're so focused on just driving fast, getting things that we forget
and
to
we're
like...
afraid of aging.
we don't embrace
what
the
that
age.
looks like.
People are talking about like, oh, when we went to Italy, Nir and I went there, and we saw these like wonderful families that were walking around. And I came back and I met this oncologist that I worked with, and he goes, they just have figured out life. And I went, what do you mean? He's like, well, they just have figured it out. They live such a good life. And when you talk to older Italian people, they're like, well, you just embrace life.
Yeah.
And part of embracing life is embracing aging.
Sure.
You know?
Yeah.
Mind you, I say that now, and I'm talking to you about I lift or something.
I'm not going to lie that I actually bought a supplement to reverse gray hair. I'm not going to lie. You can see it's not working, right? You know, you get hooked and thinking, well, could this be real, right? And I'm in the profession.
Yeah, I know.
And I know it's not going to work, but still that little fear and, you know,
I know,
curiosity in me.
And my feed is my Instagram feed is populated with like, you know, how to feel younger when you're...
Yeah.
So But it's
There's
targeted.
some entities are making bank on this concept of longevity and anti-aging. And it's very frightening to me what people are doing to really go to certain levels to try and achieve what. What I spend a lot of time talking to my patients about is everybody wants that easier answer and that easier solution.
Yeah.
To feel better, to lose weight. I mean, at the end of the day, you are going to make the most benefits by moving, eating well, exercising. You're going to live the longest. We know that. There's studies that actually show if you really want to live longer, move.
Yeah.
Move.
Which is really funny because, if you watch that interview with Peter Attia on 60 Minutes, and he talks about like the hand grip. So that study, there's like a lot of data behind length, longevity, and like the length of your age and how you get out of a chair and like a grip.
Right.
So like fast forward, what's coming up on social media is like, how long can you hang from a grip? Like, that's not the test, right? It has nothing to do with how long you can hang from a monkey bar.
Yeah.
It is just like your strength of your grip when you're 67 years old.
Yeah.
Guys who have weaker grips tend to have weaker hand muscles, weaker arm muscles, and it's, if you have weaker muscles, there's a lot to it.
Yeah.
Right?
Yeah.
So I think like those sort of discussions, I love the way you phrase that. The longevity is like, what is it? That's the really interesting thing right now. The wellness world, the longevity world. What do you mean by that?
Right.
Are you providing me something that's going to make me live longer?
Right.
Because if you follow like the Attias of the world, he's like saying exercise, diet, which is essentially what my grandparents said.
He is trying to promote more of the quality of life and what you do now to make it almost less suffering, for those patients who don't take care of themselves or have those chronic conditions. Yes, with medical intervention, you may live a little bit longer, but the quality of your life is not there.
Yeah.
So what can you do now to really extend your life? I want to get older, but I also want to feel as well as I do now and be able to move like I do now. How many times have you, Dr. Seth, as a hospitalist, walked into, and it's the same typical story, the same scene, you walk into a hospital room and it's the 85-year-old, frail, overweight female with her daughter at the bedside who fell, broke her hip, and she is crying, and you are there because you are admitting her, and the cardiology team right before you walked in is asking you to clear her for a surgery. And she looks at you and looks at her daughter and says, I just don't get old. How many times have you seen that scenario, right? And it's so complicated when you want to look and say, why didn't you, who could have intervened sooner to get you moving? Was there hormone replacement therapy that was missed? What could we have done different? Did medicine actually fail this patient, right? Did you fail yourself? Like what everybody wants to take the pill to make it easier, but I don't think that's the answer.
Yeah. I think that's it. Every time I travel now through the United States, and especially going up to the Midwest, you can see just difference in sizes of human beings. There's a little bit more incidences of overweight, obesity in the Midwest as opposed to that in the South, like South Florida here. And now the Southern United States is different, but South Florida in particular is a little bit different. And when I think about that, for the past like 10, 15 years, the struggle was, why aren't everybody exercising? Why isn't everybody? But now with the intervention of GLP-1 medications, actually it's funny because like I told Nira this, I was like, I'm walking to the airport and I'm like, I think you need to call me. Like, I want to like give my card out. I'm like, trust me, you're 400 some odd pounds, but promise you, your life is not over. Like, we can get you there.
Right.
So that's one of the reasons why I like GLP-1 medications,
I agree.
because it gives like an opportunity for people who've tried and failed so many times.
Because I do, at the end of the day, believe that metabolic syndrome can interfere with some patients' ability to lose weight. I mean, if you don't address that, it may be difficult just with diet and exercise alone. I think it's truly a metabolic condition, and that's why we've talked before, why the GLP-1s are so effective. But I think it's not alone. You need to put in the work. It is hard to be healthy.
Yeah.
It is hard to eat well. It is hard to exercise, but get comfortable with the hard, right?
Yeah.
It is hard to be a doctor. It is hard to be a dad. It is hard to be a business owner. We do it, right? Nothing is easy, but get comfortable with your heart. That's what I tell patients all the time.
Yeah.
So, what else have you seen that has caused you to pause a little bit?
So I think nowadays what's going on is a lot of like anti-wellness conversations, and they're doing that by exposing a lot of the public sentiment and public things that are coming up. I think like the world's exposure to chiropractic spinal manipulation, as described, cervical spinal manipulation, that stuff. I think that stuff is really important to be aware of. I've worked with family members who've gone through chiropractic. I actually had chiropractic manipulation when I was in my early 20s. I wouldn't say that it necessarily helped me, but what it was advertised was, because I suffer from asthma, and it was advertised as it's going to be a cure to your asthma. Well, shocker, it wasn't, right? And when I landed in the hospital the second time after the chiropractic manipulation, it wasn't because of it. It was just because it wasn't what was going to help me.
Yeah.
Right. So that part bothers me. I'm not saying there's not a role for chiropractic treatment. I'm saying it does not have to do with systemic medical chronic illnesses. Right.
I also have a problem with chiropractors that are trying to, as you say, manage chronic disease states. And, some states, I think they're even allowed to prescribe medicine. I wouldn't have felt comfortable just out of medical school doing that. I mean, I went to an internal medicine residency to learn how to do this for 4 years, right?
Do you remember the first time you prescribed a losartan?
Oh, I was
or Lysine? I was like, check a potassium every single day.
Scared to death. I have new doctors that are doing that, right? And I'm not saying that they're very cavalier, but also I want to say stay in your lane. Right. So.
Now, like there are what's really funny now is that in the social media landscape, there is like chiropractors who are fighting against chiropractors. There's like guys like, I follow this guy, his name is Kimchi Chiro, and he's great. He's got this like great stuff. He talks about wellness, but he also talks about like, a rehabilitation, chiropractic therapy in the form of rehabilitation. He's great. I love his work. I love his stuff. And I think that's a reasonable thing. It kind of blends a little bit of physical therapy into it. And he's really intelligent about it. But I mean, I hate to say, he stays in his lane. It's the ones where they don't stay in their lane. And you're like, guys, like your knowledge about this is so subpar.
Right.
And you're making things up. That's where it's dangerous.
Right.
Okay, fine. You don't have the knowledge of cardiomyopathy. Cool. But why are you making up the word inflammation in cardiomyopathy, right? Like, chill out.
Right. Or adrenal fatigue.
Right.
I have so many patients that will come in and say, the chiropractor told me I have adrenal fatigue, and they did this, $400 test to confirm it. And I'm thinking, what is adrenal fatigue? That's something we didn't learn in medical school.
Right.
I think we're all adrenally fatigued.
Yeah.
If you truly had a problem with your adrenal glands,
there'd be problems.
Right.
Yeah. 100%. You'd be hypotensive and you'd be,
Absolutely.
So, I mean, adrenal insufficiency is a legit condition. Adrenal fatigue is not a condition.
Correct.
There's also that whole world. I don't know if you remember about chronic Lyme.
Oh, yes.
So like, like they'll do a Lyme, antibody, and then it's positive, and they'll say, well, you have Lyme. That doesn't necessarily mean you have Lyme. It means you're exposed to it. But, and then they'll be on these long-term ceftriaxone antibiotic infusions.
Right.
They get really popular.
It's like this chronic strep. There's this other pediatric illness.
Is it really? I don't know much about that.
That it's this chronic strep It was very, I mean, a lot of patients seemed to think if they had multiple strep infections that it led to some mental status changes and personality changes. And so the treatment that some of these non-MDs would be providing is chronic amoxicillin. So that's eating up their gut, that's destroying their gut barrier. But they claim that it has a way of controlling their mood.
Wow. I mean, there's so much in the wellness world right now, and it's hard to pinpoint like things that are like bothersome.
Yeah.
But I mean, so I'll tell you one thing that I experienced. I had to do, like I said, I went to this hormone replacement therapy treatment seminar. And, you know, I come in with from a physician standpoint, a critical view. And you should never go to any sort of seminar and be like, this is the best thing since sliced bread, you know?
Challenge it.
Yeah, always come in with a critical thought and be like, how is this going to harm my patient? Because if it's going to harm, then that's what I'm aware of. Well, I went to this hormone replacement therapy. I sat there and I'm listening to the lecturer, and the lecturer's knowledge is pretty subpar. Okay, fine. I understand that. But what scared me about this was everybody in the hall was like, and this was a hall of like 250 people. Okay, these are all potential prescribers of this. Okay, they've come from all over the country. Rare medical doctors, not maybe 3 or 4 of them. Most of them are nurse practitioners, PAs, and they are like, they're eating this up, right? And they're like, this could be the treatment for everything, and you're like, guys, that can't be it,
right?
And then that scares me, like, what's happening in the public?
Yeah,
you know, like, because these medications have legit side effects,
right?
And there are risks,
Right.
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 And if you just think that there's no risk with it, then the possibility of errors is high.
Or if you suggest, even as the physician, who patients come in and they want ivermectin for COVID, yes, there may be some potential benefits, but is that the gold standard for treatment, right? You know, but they look at you funny. I think it's just been so politicized now that patients are very untrusting. You know, some final thoughts I have on the subject is that there's definitely, with social media, a lot of wellness trends. And I tell patients, and this is where concierge medicine comes in, where we are those advocates for our patient. We have the time to be an advocate to hopefully gain their trust, to point them in the right direction. I'm not against them to go have these outlets and see, but I just want them to be smart, and I don't want patients to be taken advantage of.
That is like, I can't believe that how many people make billions of dollars off this. And then, by the way, one of the things that drives me nuts is like, they're like, pharmaceutical companies bad. Meanwhile, like non-pharmaceutical, non-FDA approved is just as rich as this.
Or I don't want to take a medicine, Dr. Parker. I'm against the pharmaceutical company, but can you refill my Mounjaro? Any other thoughts tonight?
I mean, I think this is the takeaway is, if you think it's the best thing in the world, it's probably not.
Right.
If you think it's the cure-all, end-all of everything, it's probably not. Talk to your doctor, and if your doctor says it's the cure-all, find a new one.
Exactly. And then, take time for yourself. Make sure you are getting that exercise in. As stupid and cliche as it sounds, it has the lasting impact. We all need to eat better. We all need to exercise and move a little bit more and be kinder to each other.
I need to eat more.
Thanks for spending time with us today. If you take one thing from this conversation, let it be this. Wellness isn't the enemy, but unchecked wellness claims absolutely can be. Patients deserve honesty, evidence, and guidance, not fear tactics or miracle cures.
And at the end of the day, no supplement, no drip, and no device replaces the basics. Move your body, eat well, manage stress, sleep, and take ownership of your health. Longevity isn't something you buy, it's something you build. If you found today's conversation helpful, subscribe, leave us a review, share this episode with someone who's knee-deep in wellness confusion, and as always, shout it from the rooftops.
And if you're in Tampa or Las Vegas and you want a care that's really grounded in evidence, not trends, we'd honestly love to take care of you. In Tampa, visit Seth Premier Medical, and in Las Vegas, see us at Parker Medical. Links are in the show notes. Thanks for listening, and we'll see you on another episode of Out of Network.